Lithium can have negative effects on the kidneys. WIA-E, nephrogenic diabetes insipidus with polydipsia and polyuria reductions in GFR microcysts, tubular atrophy, and focal interstitial nephropathy long-term therapy. Less 10 years will increase risk of renal tumors. Antiepileptics, MOA sodium channel modulators are valproate, lamotrigine, carbamazepine, phenytoin, zonisamide, and oxcarbazepine. GABA receptors are benzodiazepines including clobazam, clonazepam, diazepam, lorazepam, midazolam, and barbiturates including phenobarbital, primidone, and stiripentol. GA-T1 GABA transporter is tiagabine. GABA transaminase is vigabatrin bind to synaptic vesicle protein 2A is levetiracetam, and brivristam bind to alpha-2 delta protein subunit of high-voltage activated calcium channels are gabapentinoids including gabapentin and pregabalin. Side effects for antiepileptics, levetiracetam and mood changes, depression, aggression, sedation, dizziness, hedache is SJS, TEN. Extrapyramidal side effects by the first-generation antipsychotics like chlorpromazine droperidol, flupentixol, haloperidol, paraschiazine, zuclopenthixol. EPSE includes acute dystonic reactions, akathisia, tardive dyskinesia. Common AE, sedation, due to H1 receptor blockade orthostatic hypotension, due to alpha adrenoreceptor blockade hyperprolactinemia, sexual adverse effect due to D2 receptor blockade blurred vision, mydriasis, constipation, dry mouth, urinary retention, due to muscarinic receptor blockade due to muscarinic receptor blockade gabapentinoids, gabapentin and pregabalin modulate neurotransmitter release. Explain how. Antiepileptic. It binds to alpha-2 delta protein subunit of high-voltage activated calcium channels. Antiepileptics have neurotoxic adverse effects. A neurotoxic adverse affects drowsiness, fatigue, dizziness, blurry vision, incoordination. How might it be reduced? By reducing dose, reduction of polytherapy, substituting a better tolerated antiepileptic. Valproate is generally well tolerated than other antiepileptic drugs. Side effects for sodium valproate. Common: nausea, tremor, hair loss, weight gain. Rare: hepatic failure, pancreatitis. We second-generation antipsychotics like olanzapine cause weight gain. What can this also lead to long-term? Antagonism of 5-HT2C receptor affect appetite and metabolism. It may develop hyperglycemia and higher risk of diabetes mellitus. The largest gains are usually seen with clozapine and olanzapine, the least with ziprasidone. Antipsychotic most effective for resistant patients. Clozapine adverse effect of neuroleptic malignant syndrome. Why? How long? NMS is a rare neurological emergency triggered by the use of first-gen antipsychotic medications. Fever, rigidity, mental status change, high blood pressure, rapid breathing, and excessive sweating. It progresses rapidly over 24 to 72 hours, higher in young men. MOA of second-gen antipsychotics like amisulpride, aripiprazole, acinapine, brexpiprazole, cariprazine, clozapine, lurasidone, olanzapine, paliperidone, quetiapine, risperidone, ziprasidone in the treatment of psychosis. It strongly blocks 5-HT2A receptor than D2 receptors. By blocking the 5-HT2A receptor, it increases the release of dopamine, so this is responsible for the reduced incidence of some of the adverse effects that blockade of the D2 receptors would cause. It also acts as partial agonists at 5-HT1A receptors, resulting in a synergistic action on 5-HT2A receptor antagonism. They are also believed to act as antagonists at the 5-HT2C receptor, which modulates appetite and metabolism. But aripiprazole and brexpiprazole are partial D2 agonists with a weaker effect than dopamine. And cariprazine is a D3 preferring D2 and D3 receptor partial agonist. Second-generation antipsychotics can cause QT interval prolongation. The most likely drugs: amisulpride, ziprasidone. Multi-organ hypersensitivity syndrome. For patients who started an antiepileptic, how long to take for it to occur? 2 to 6 weeks of commencing therapy. What symptoms would you be monitoring? Early symptoms include SJS, TEN, fever, swelling of lymph nodes, blood abnormalities, the most common drug causes. Lamotrigine, carbamazepine, phenytoin, phenobarbital, allopurinol. Sulfonamides commonly cause other names can multi-organ hypersensitivity syndrome known as DRESS, hypersensitivity syndrome. Drug-induced hypersensitivity syndrome gum hypertrophy is a common side effect of treatment with which anti-epileptic, phenytoin benzodiazepines, clonazepam/clobazam/diazepam/lorazepam/midazolam, are not generally used for long-term treatment of epilepsy because of sedation and development of tolerance in most patients. They are mainly used for acute treatment of status epilepticus. Lithium requires regular therapeutic drug monitoring with doses adjusted according to the plasma concentration. Explain why this is required and include in your answer 4 adverse effects that might be associated with lithium toxicity. Initial monitoring should occur 5-7 days after commencing treatment and after each dose adjustment until stabilized, then every 3 months. Lithium has a narrow therapeutic index, and a long duration of action toxicity may occur when concentrations rise by 25-50% over therapeutic range, particularly in elderly patients. Also, toxicity may occur at lower than usual concentrations in patients with pre-existing brain injury or disorders, ADHD, autism, Alzheimer's disease, epilepsy. Mild to moderate signs of toxicity: increasing GI disturbances, nausea, vomiting, diarrhea, tremor, muscle weakness, drowsiness, apathy, flu-like illness. Severe toxicity signs: increased muscle tone and reflexes, involuntary twitching, tremor, speech difficulties, psychosis, seizures, coma. 5 marks for each of the drugs below state whether they are a first-generation antipsychotic, second-generation antipsychotic, anti-epileptic, or indicated both as an anti-epileptic and a mood stabilizer in bipolar disorder. Which one of the below can also be used in the treatment of anxiety disorders? Lithium bipolar I disorder and prevention and treatment of mania or depression, carbamazepine antiepileptic and mood stabilizers, sodium valproate antiepileptic and mood stabilizer, lamotrigine mood stabilizers, and antiepileptic. Why no antipsychotic is first-gen or second-gen is important. Efficacy against negative symptoms are less in second-gen. Incidence of extrapyramidal side effects are less in second-generation. Group receptor profile is different. First-gen is strong D2 blockade, and second-gen is combined serotonin and dopamine effects. Tardive dyskinesia may be irreversible. Symptoms may still stay or get worse after stopping medication.